Welcome, everyone. We're just gonna pause, um, wait for the others, wait for Dr. Kwok to show up. Welcome, everyone. We're Professor Kwok is on her way, so we'll wait for her. And in the meantime, I respectfully ask Venerable Hong to lead us in a silent meditation.
Okay. Let's take some deep breaths. Try your best to relax. Let go of your thoughts, thinking, planning, fear, worry. And remind yourself to relax. She's joining us. Allow your body to settle. Notice your posture in the chair that you are sitting on. Start with a smile. Notice how you feel when you smile. And how that feeling gives rise to the sensations in the body.
Joanne, can you turn on your camera? We see your PowerPoint. We don't see you. There
There
you
you
go.
go. Go
Welcome,
ahead.
Joanne. Finally. Okay. So uh, I guess we'll turn it over to Professor Clark now, right? Professor Venerable Hong. It's okay.
Yeah, go ahead, Joanne.
Well, I guess we'll have you. We'll let you do your presentation. We have students on Insight Timer. We have students on YouTube, Facebook, as well as Zoom. So we'll each turn off our camera then.
Thank you. Can everyone hear me well?
Yes.
Without the echo now? Good? Okay. Good evening, everyone. My name is Joanne Kwoh or I'm so known as Dr. Kwoh at University of the West. I am presenting on Mental Health 101 this evening with Dr. Danny Mew and Venerable Hong. And I'm so honored to be here to share my knowledge per se, and in a way convert it into everyday terms for all of us to understand, grasp, and even apply more in the way that we see, hear, and do every day about our mental health. If you don't mind, I would like to have questions later on after my presentation, but there might be some kind of interactions during this presentation. It was first designed as a workshop. So I am a professor and the chair of Department of Psychology at University of the West. I am also a consultant to YWCA San Gabriel Valley. This is in Covina of California. We are all in Southern California. So I worked with them for about 2 years before I came over to University of the West in August 2023. And I love my work and mission over there at YWCA. So I maintain my position as a consultant to them, and I do regular workshops with them, mostly through University of the West, but sometimes on my own with them. And this is the second time I'm presenting with Dr. Neil and Venerable Hong. So I'm also extending my community outreach beyond YWCA and University of the West. So today our topic is about mental health 101. Some people would wonder what 101 is. For those of us who have gone through the traditional setting or a system of American college system, most of our classes during the first year are 101, the code of Psych 101 or Business 101. So 101 is an alternative term of basic information in an area, and in this case, mental health. If possible, if we have time today, it is about 6:08. If you can scan this or go to the link there for a 2-minute quick check-in to see what your knowledge in mental health is. I would do this if you have a phone on you and scan the QR code and then go to the link and answer a few questions. And these are the questions will give me an understanding what you know about mental health and how you feel about mental health. There will be then a post survey to see if we have gained anything in our growth and knowledge after this about 45 minutes workshop or presentation. So take your time and do that while I proceed slowly. So it's about 5 to 7 questions, 2 pages if I'm not wrong, very quick, no-brainer answer, very straightforward questions. And I will proceed slowly. And if you need me to slow down, please say so in the chat or let me know. So a little bit of the community guidelines as you complete that pre-presentation survey. We would like to have one person speak at a time if we were to be engaging in speaking this evening. We will be respectful to each other. No judgment, not for others, and especially not yourself. Sometimes we may be talking about topics or or subject that you might think about some areas in your personal life or professional life, and there might be a moment of judgment, we will be reminding ourselves to be gentle with ourselves and others. And if there is any discussion of a personal case or someone whom we might know in our social circle, usually in a group therapy setting per se, that we will talk about the case very intimately. However, the discussion stays in that group. We will not go out and talk about, oh, we talk about so and so in that group discussion. In tonight's presentation, I don't think I'll know any one of you personally except maybe Dr. Mew and Venerable D. Hong. If we were to use any personal examples to illustrate some cases, and that will stay here. We will not use it outside of this setting for unknown reasons or reasons that are not necessary. So confidentiality, meaning we are respectful of each other's privacy, is key. All right, so tonight's agenda, we will talk about the objectives of the presentation. We will discuss what mental health continuum is. We will have a deeper understanding of what our mental health means and what the challenges are in our day-to-day life and how we can support our mental health. So the objectives that we will try to achieve and hopefully achieve tonight, this evening, would be: number one, recognize what impacts our mental health. Number two, identify factors that we can and cannot control. Number three, identify at least 3 ways to support your mental health. For those of you who are not parked on the side of the road, definitely, hopefully not driving. If you're driving and you're listening, that's fine, but safety first. For those of you who are able to take a piece of paper and pen later on during our presentation workshop time, I would appreciate that you would join us later on and participate in that. Because we will be talking about at least 3 ways how we can support our mental health. Continuum, and this is expressed in the circle here in tonight's presentation. Continuum is a big word for continuous spectrum line, as you will. In this way, when it's expressed in the circle, it means that it never ends. It goes on. It repeats. It is a cycle. So in the past, very recent 10, 15 years ago, we saw mental health as you're either mentally healthy or you're not mentally healthy. Very black and white, very day and night, very concrete. It's like only people who are mentally healthy are functioning in the society. Those who are not, it's a different group of people. If we have evolved successfully as a group of people living in, California, in the world, we would know that that is not the most appropriate thinking, because a lot of us have our own conditions and challenges, but we are functioning. We live in a society, we get along with others, we work, we make a living, we contribute to the society. Let's take a look. When we are thriving, all of those examples that I've just talked about, we work, we make a living, we have a recreational life, we have hobbies, we volunteer, we have a pet that we are responsible for. Some of us get married or have a partner and have offsprings, the next generation. Those are cases that demonstrate that we are thriving. We are really doing well. But we're not always that case, right? We all know that. Sometimes, yeah, things are pretty good. We have a job, we pay our bills, we are managing. But it's not like, every day is a sunny day. Every day the puppies are smelling good. Puppies come with poop and pee. So that's just an analogy that, we have our good parts of our life. We have our not so good parts of our life, but we manage. However, when we are not managing, we might be struggling. And this is the time that we should even more pay attention to how we are coping with our mental health. I'm not saying that during thriving stage or during managing stage or phase, we don't pay attention to our mental health. We should always put mental health on our forefront. But when we are struggling, it's time for us to act on what we should be doing. And because if we are not doing anything by this stage, we will experience distress. Let's go stage by stage by stage by stage to see what these four terms refer to. And before I go to the next slide to talk about thriving, what thriving means, as I mentioned, a continuum, meaning a continuous line or a spectrum, or in a cycle, means that we can evolve or change from a stage of thriving to managing if we are not taking care of ourselves. And if we are not even managing, we can be struggling, and then we can be distressed because we are not coping well with our struggles in our life. However, we can also become thriving again if we do take care of the things that we need to take care of. And this can go in cycles, long cycles, short cycles, repeat, depending on how we are managing the stressors in our life. And also there are other factors such as medical, genetic, environmental. We'll get into details. So what does thriving mean? Some of the examples that I talked earlier on, I was a little bit, drawing a little bit from how I live my personal life. So this is where we want to be. We feel good. I have a dog. I love my dog. I'm married with children. My family gets along most of the time, living under one roof. We feel balanced besides being useful at work, friendly with our neighbors, collegial with our co-workers, but also at the same time taking care of our family and our personal needs. My number one enjoyment is sitting on my swing, my deck swing on my patio at home, doing nothing, thinking nothing. That's my number one enjoyment. Hopefully with a dog by my foot. So that's my number one balance, personal activity. But I also need to work. I feel energized. I feel useful. I feel joyful when I'm at work. So I'm not just only working. I'm not just only sitting on my swing chair, but there's a spectrum of activities that we feel balanced with the needs that we have during the stage of our life at that time. And therefore, we are able to regulate our emotions and cope with the challenges we may experience, be it work, school, or relationships. Because, if you don't have challenges in your life, then what is life? Life is full of ups and downs. I had a whole day full of activities. There are challenges, there were barriers, there were obstacles, but because of my training, my coping strategies, they were overcome in a way almost it appears that it was overcome with ease. But if you were to give these tasks to someone who is 20 years younger, who has no training or without the experience, this would have been a completely stressful day for that person. So we need to learn how to regulate our emotions, but it's not something that we can do it overnight. We need to know how to cope with our challenges, but we need to have training, support, and other experience in our life. When we are not experiencing all the joyful emotions and feel like we are useful, we enjoy what we do, this is a good thing that happened to me. Oh, that didn't go well in my way, but that's okay, life happens. That's managing and coping, with the challenges with our life and emotionally overcoming those challenges at the same time, both realistically and emotionally. But sometimes when we are overwhelmed, we will be feeling that, oh, this is stressful, this is not going my way, but I am still making it work. I still go to work. I still get along with my colleagues, although I don't like some of the interactions, or the drive to work is just too much, it's 2 hours each way, each day. But this is what I have to do for my life right now. I'm managing it. I'm making it work for me. But I'm not as joyful. It doesn't seem like what I'm doing, it's giving me a lot of what I need in return. When we begin to struggle, of course, we're talking about emotional struggle here. We can have physical challenges and struggles, but when we have emotional struggles, they will start to impact our work, school, and relationships. And I don't think that, this is some new information to any of us here. We know that when we are sad, when we are angry, when we are disappointed, when we are frustrated, they affect how we feel in that moment, and sometimes it affects the whole day or a whole week, and sometimes a whole month. However, when we are in a managing stage, we are still able to work past that, maybe because we're just busy with whatever we have on our hands. We forget about them, and then the next day the problems came back again, and then we have the same emotions. However, when the struggles become so big, we will start to not cope with our job, deal with our relationships, or even take care of ourselves. So what do? The first thing that we can do, we can acknowledge that we are struggling. It might seem like, oh, this is a no-brainer thingy. We are struggling. We have to tell. We're telling our best friends that we're not doing good. We're telling our teacher, hey, I don't think I can pass this class. That's a common thing that we would think someone would do. But you will be surprised that many of us do not ask for help because of many things. Number one, maybe because we're not used to, because of cultural background, because of training, because of, different values in life. And some of them feel that asking for help is a sign of weakness, and therefore they will not ask for help. So without the acknowledgement that you need help, you will never ask for help. And we can then identify ways to take care of ourselves. There's this term called self-care that we talk about so much these days for the past 3 to 5 years already. A lot of people refer to self-care like a trip to the spa, which is nice, manicure, pedicure, which is nice, or I'm a foodie, a good meal, very nice, hanging out with friends, sitting, having coffee, self-care, very much so, very much so. But these are not the only self-care activities. In my words, and I've defined this myself, self-care means being able to take care of yourself before you need someone to take care of you. And let that sit with you for a moment. What does that mean? We take shower, we brush our teeth, we tie our shoelaces, we get dressed, we drive ourselves to work. We take our car to car wash. These are all very basic, simple self-care activities. It might seem like, oh yeah, you do this, it's natural, it's common sense, it's a day-to-day activity. There are so many clients of mine, especially when I'm talking about my own clinical experience. Brushing teeth is a very hard thing to do. Taking a shower every day is a challenge for them. I'm not talking about people with physical disabilities. I'm talking about people with depression and anxiety and the lack of motivation. Even when they walk in the hallway and they drop something, they don't even have that motivation to pick it up and throw away, or pick it up along the way and bring it to wherever that thing belongs to. So when we are able to take care of ourselves, starting from the very basic things like what I just said, shower, personal hygiene, or taking ourselves to work, or being able to cook ourselves a meal. These are the things that we need to identify that we probably have to take care of ourselves first before we look further about how to manage the other parts of our life that's causing us to struggle. And reach out for help when you need. One client of mine once asked me, when can I stop going to therapy? First of all, I have to define therapy. Therapy can be talk therapy, one-on-one. You see a psychotherapist for a 50-minute traditional therapy session, and you talk about what's going on and how to make progress or growth in your life. But therapy can also be singing. Therapy can also be having a pet. Therapy can also be walking, exercising, dancing. These are all therapeutic work. So my answer to that client is that we probably could use lifelong therapy. But talk therapy, once you're able to transfer the skills outside of the therapeutic setting and you can use it in your whatever therapeutic work that you engage in, such as singing, dancing, walking, meditation, then you can stop using talk therapy for a while. But there's nothing that should stop you from engaging talk therapy again, should you find the need to. And reach out for help is not just going to therapy. The other therapy that I just talked about, like meditation, taking a walk, exercising. Get a friend, go to the gym together. Get a friend, walk with you together. If you can, get a pet. The dog will help you, will motivate you to always take care of the dog while you walk together once a day or twice a day. Or you can reach out at work to someone that you trust. For a student, you can reach out to a professor or a teacher. For co-workers, I hope you have a work buddy that you can always tell your buddy about something that you need help on, need a pair of listening ears. We always think that asking for help means asking for advice. Not necessarily. A lot of people just need to vent or be heard and not advice. This is when talk therapy is most recommended when distress happens in our life. When distress happens, it is interfering with our family, with our relationships, with our school or work, with our ability to get things done. This is talking about not wanting to get out of bed, not being able to sit through an hour of lecture, not being able to make a meal for yourself, not being able to have a healthy communication with a family member because of the challenging mental health condition, because of all the internal conversations that's going on in the head. So when we understand our mental health better, it's now maybe taking 30 seconds to assess what I just talked about, the continuum, the thriving, the managing, the struggling, and experiencing the stress. Where are we right now? So the first thing to do is understand, am I in the thriving phase? Am I in the managing stage? Where am I right now? And knowing that what kind of factors could affect how you are being placed per se in those stages or phases. And knowing that these factors can sometimes be controlled and sometimes not. So we will look at some of those factors of what we can control and what we cannot control. Now, I learned about this concept about control the things that you can control and then leave those that you cannot control alone. I learned about the concept, 30 years ago? But every day I'm getting an epiphany, a new finding, a new understanding of how that is. And I find so much joy in that when I say, that's something I can control, and I work on it. And I want to say, oh, that's up to that person. I can't control that. And I move on very easily. It took years of practice to understand that that's really not within my control. And that gives me so much liberation that however much I want to worry about it, be anxious about it, fret about it, it's not going to change. Might as well let it go. and move on to make changes about things that I can really control. I hope we have time, and maybe I am able to release a few examples later on when we have some interactions to really talk about what exactly are things that we can control and cannot control in our each and everyone's personal life. But right now, I'm going to show you some of the universal and common factors that we cannot or can control. Let's first look at the things that we usually cannot control, or according to this slide, we cannot always control. Genetics. We are who we are. We are born this way. Yeah, sometimes we can do some changes like the Kardashians, but that's just the phenotypes that you can change. Phenotypes means features that you can see with your bare eyes. Your genotypes, the dominant genes, the recessive genes that determine your hair color, your eye color, the widow's peak, the earlobes, you can't change those. You can change the phenotypes. You don't like your earlobes, you can do some cosmetic surgery, but the genes that you carry that you will pass on to the next generation if you wish to have children will remain the same. You can't change them. Not at the moment. I'm a scientist, so I believe in science. Maybe in the future there may be some changes. So I cannot say 100% you can't change, but up to this moment, we don't change our genetics. Upbringing, early life experiences, we can change the next generation, but we can change what has already happened to us. Who we are today, our upbringing, our early life experiences are already history taken place. So we can't change that. It's in the past. Past trauma and challenges, whatever we've experienced in the past before, is part of our story, something that we don't erase per se. Our medical history, like if a little self-disclosure here, I had a series of panic attacks. I was bordering panic disorder, but I did things within my control, and I managed to have it under control and not develop into a panic disorder. If we have time, we'll talk about how panic attacks develop into panic disorder. But I was perimenopausal, and that brought a lot of hormonal disruptions, and therefore the panic attacks. And that's something that I can't change. I couldn't even do anything about that but despair at that moment. This was about 10, 12 years ago. What people think of us? I would like you to love me, but I can't force you. You can't do anything about it. The only thing that you can do is what you can do about yourself. How people treat us or how they don't treat us. Nothing you can do about it. Access to quality mental health care. Now, this is because we researched this and put this information right here. So although I question that, in general, that's something that we cannot control, but we kind of sort of can pick our insurance. For most of us, we kind of sort of can pick the doctor that we want, because I know someone who is rude or not to my liking, I can stop seeing that doctor and select from my network what are the doctors that I can go to, right? So access to quality mental health care, yes and no, but for majority of us, that's something that we cannot always control. Now let's look at the things that we can control. The way you perceive mental health. Like today, I'm very glad and honored that you're here to help us kind of level up our game about what mental health is. The coping strategies that we decide to use are something that we can control. The self-esteem and sense of purpose, self-care routines, those examples that I mentioned earlier, the meals that we make for ourselves, the exercise, meditation. I haven't mentioned sleep at all, which I'm surprised myself, because sleep is the number one thing that is contributing to my good mental health. My sleep is sacred to me, and I sleep with a clean heart every night, and I wake up refreshed the next day. We'll talk about that later on if we have time. How we manage stress and anxiety, very important. Our relationships with our family and friends. I mean, we are social animals. We live with someone. If you live alone, congratulations, you're lucky you. I'm just joking. If you live alone, you may not have that day-to-day under the roof interactions, but you sure go out, maybe go to a drive-through, get to the grocery store, some kind of social relationships. Whether or not we use or abuse substances or otherwise known as drugs, that's something that we can control. And when we talk about drugs, maybe immediately we think about weed, cocaine, LSD, the latest thing, ketamine. No, I'm referring to caffeine. Not just caffeine only, but caffeine is one of the most used, if not abused, psychoactive drug in this country, caffeine, and that's the number one thing found in our coffees. And I'm also addicted to it. Willingness to talk openly about our thoughts and feelings. And that's me. I'm an open book, but I'm not saying that if you're not extroverted, if you're not social, then you're not a happy person. Although there have been studies that correlate extroversion, meaning you're outgoing, you're more willing to share your feelings and thoughts, you're more willing to share your joy with other people, and when you're sad and down, you're able to express it verbally, emotionally. Those indicate that a person will live a longer life. There are studies out there. But happiness is most of the time subjective. Does extroversion really lead to a happy longevity? Some introverted people or individuals would tell you that I don't need that kind of, traits to stay happy. And that's 100% true. Whether you're introverted or extroverted, we find our ways to recharge our energy and lead our lives according to our healthy coping strategies to help ourselves attain the happiness in our definition. So although willingness to talk about thoughts and feelings are not 100% sure indicated to happiness, but it is something that we can control. So if we are happy and we share, there's an energy that goes up. And if we're sad and down and there's something troubling us and we don't share, that's going to lead to isolation, more depressive symptoms, maybe panic attacks, maybe anxiety, and so on and so forth. And therefore, it is something that we can control that can help with our mental health. All right, I'm doing a time check. It's 6:37 p.m. We're doing good. So let's talk about the mental health challenges that we have. Negative feelings. Some feelings can be good for us, such as fear, as it keeps us alert and safe. Feelings of anxiety, anger, and sadness interfere with enjoying our lives. Whatever the tough feeling is, it's important not to ignore us. Now, if I were to go with a biopsychology perspective, the amygdala, it's a little thingy in our brain, it's a little structure in our brain that affects our survival instincts. And we need to have that kind of feelings, because if we are not afraid of a snake, we get bitten. If we are not afraid of heights, we fall. So we have those natural instinctive feelings. The key is not to let those negative feelings take over our overall well-being or the whole emotional expression of that day or that week or maybe the month, like I said earlier. So these are natural emotions. We do not shun them. We embrace them, but we do not let them take over our well-being. Difficult experiences can create emotional challenges, something like breakups, losses, maybe a loss of a family member. I just lost my dear basset hound of 13 and a half years on Monday. The sadness hits me out of the blue sometimes. I can be telling a joke and then I'll start crying. I am very aware of it, so I actually reminded myself tonight that if I were to talk about this, I'm not going to cry. I'm clinical about it right now, but later on, maybe when I drive home, I might cry. But again, these are part of our life experiences. They can become a challenge if we don't manage our mental health the way we should. Sorry. I want to talk about trauma first. Trauma, what is trauma? The definition is an intense emotional response to overwhelming and stressful events. It may not show up immediately and can happen when you're unknowingly triggered years later since the event. Some of the examples of a trauma are violent acts, sexual assault, natural disasters like the recent LA fires, and ongoing abuse such as an intimate partner or a parental figure or someone at work who's a bad bully. That's ongoing abuse. I just want to sidetrack a little bit that not every trauma will lead to PTSD, which stands for post-traumatic stress disorder. Not every trauma needs to become a factor of PTSD. So many of our clients, if they have experienced a trauma, the most pertinent action will be to make sure that this does not linger and become a cue or a prompt of a PTSD. Now, PTSD will only be labeled or diagnosed if the symptoms, if the expression of the symptoms, such as nightmares, flashbacks, intrusive thoughts, hypervigilance, remain for a period of 6 months or more, and interventions would help. So, yes, if I have experienced a bad car accident, it's a very traumatic emotional response, and I will be scared to drive for a few weeks. That's not unnatural. However, if I have timely interventions, in time to come, I will overcome those fear and vigilance and avoidance and start driving again. So the time before the car accident, using this car accident as an example, had I been in the thriving stage of mental health continuum, I would recover and bounce back faster. But if I were in distress, this car accident may have a very, very long and tragic kind of experience on me that I may not ever recover or will not recover for a long time. Mental health conditions. Feeling anxious or loneliness is normal. However, when your thoughts, feelings, or behaviors become severe and last for weeks or months, seeing a medical professional is recommended. Harmful behaviors, unaddressed mental health conditions, or trauma can lead people to misuse substances, self-injury, or suicidal ideation. So misusing substances, growing up, I always heard in the Chinese saying 戒酒消愁, meaning to kill our misery by drowning sorrows with alcohol. I experimented with it too. It never was successful because alcohol in psychopharmacology, or the study of what psychoactive drugs do to our body and brains, alcohol is in the class of depressants. It depresses our moods. It will never ever kill our sorrows, number one. And of course, the other substances that maybe help elevate the moods for a moment, the crash is worse than the elevation. But tonight, we're not talking about psychoactive drugs. We're not going deep into that, but understanding that using substances may seem like a solution at that moment, but it's never permanent. It's always temporary, sometimes making it worse. Self-injury, we're referring to sometimes people cutting, meaning, cutting on their bodies till it bleeds, or other ways of maybe poking their fingernails into their hands. There are many other ways at this moment. I'm drawing blanks, but in a way causing physical harm to make one forget about the emotional pain, which is so much more painful that the physical pain will help you forget for a moment. Suicidal ideation, meaning you are ideating or thinking about a suicide. A suicide means killing yourself. So it may not have been a plan, it may not have been um, there are weapons or anything like that, but you start to think about how to end your life. So these are very harmful behaviors. And if we are anxious and lonely and we feel that there's no one to help us, those cases will be exacerbated and become worse. So how do we support our mental health now that we heard about mostly about the negative sides of mental health? Let's talk about how we can make it better for us. So we talked a little bit about self-care, and as I mentioned, it's beyond or more than just going to the spa or having some luxurious services, mainly to be able to take care of yourself before you have to depend on others. Sometimes it just means having a day of talking to nobody, and that's self-care. Mindfulness, Dr. Venerable Hong or Dr. Miu will be able to share more about this with you. Although I'm also a certified yoga teacher, I am leading a second series of meditative workshop at the university next month, a 5-week workshop that I will teach meditative practices because there is still a need to spread the information on meditative practices or mindfulness. Is beyond just sitting down to meditate. Mindfulness, of course, is, in a short description, is turning our attention inward and attend to our internal stimuli as compared to the external stimuli where we can see, hear, feel. But being very mindful and attend to what's going on with our body and in our mind, that's mindfulness. But it's meditation is wonderful, but not everybody learns how to meditate immediately. And meditative practices can also take the form of walking. Meditative practices can also take the form of, relaxation. So how we practice mindfulness, which actually would lead to more synchronizing of the mind and body. It's a really healthy coping strategy. Speaking of coping strategy, this is a form of self-care. It helps us to be in the present and accept challenging thoughts and feelings. There are many hundreds of coping strategies out there. And I was just sharing with people over and over again just 2 days ago, talking to my colleague when she was thanking me for listening. The number one coping strategy that I've seen, read, and collected and research on and experienced myself is griping. Griping, griping, meaning you have someone to just vent, to just let it out of your chest, to just talk about something that you both know and understand, but you don't have to do anything about it. Just talk and let it go. So that's griping. If you don't have a griping partner now in your life, think about it. Why don't you have one? Would you like to have one? And it doesn't have to take the shape of a human. My number one griping partner was my dog who passed last Monday. So she's a therapist. And sometimes I don't even say anything. I just sit there. I just sat there. I have to get used to the past tense. I just sat there with her, and that took everything away. Speaking of healthy coping strategies, I already talked about, walking, singing, dancing, having a friend, making a meal for yourself. There are also unhealthy coping strategies. In a workshop, I would then now ask people to tell me what are some of the unhealthy coping strategies, and people would let me know. Phone addiction, one thing. Any electronic addiction is one thing. I mean, we all use our phone, laptop, everything. I mean, to the point that, my phone is never off my body. I go everywhere with the phone because it connects me to a lot of things, work, people, tasks. But I've seen people who would not do anything else other than eat, go to work, any breathing moment, the eyes were on the phone. So It's a way to cope with the mental burden because the mind needs to be stimulated. And I would like to share with you that mental boredom is actually a sign of depression. So when you're not motivated to do anything else, when your mood is depressed, depression doesn't always mean that you have to be sad and crying. When you're depressed, you're uninterested, you're not motivated, you are only isolating yourself doing one activity. And that could be an unhealthy coping strategy with whatever's going on in your life. Of course, the more obvious and common ones that we know are possibly using substances or maybe purging, and that could be in a way of exercising to the point of no return. Sorry for using that term, but some people just exercise like every waking hour of the day because that's the only way that could help them, keep their mind on something without worrying or being anxious about something else. Food wise, some people emotional binge, meaning they eat till they don't till they feel that they couldn't eat anymore. That's also another way of unhealthy coping. There are many, many more out there. We don't have enough time to list all of them. Social circle, especially with our aging populations, it's a very important indicator of how we remain mentally sound and healthy, because without the interactions, without the stimulation, our mind goes down. Dull as in DULL. So not sharp anymore. So social circle, and not just one area of friends. We can have many friends, not best friends or friends forever, but different acquaintances and people of same interest in different areas of life. So besides teaching, I'm also a volunteer with my Better Hound Rescue. I'm also a volunteer with my Free Mom Hugs. I go to the gym. I do have friends of different age groups. So this expands my social circle and keeps my mind stimulated. And in a way, I feel joyful that I'm able to, enjoy other people's company and let them enjoy my company. And of course, have someone to talk about your feelings. Supporting friends who are struggling also boosts our mental health. Even just one special person, you can be honest with helps. I have a client who just shared with me that he feels so good that he has someone who is feeling worse than him and that he could help with that person, that friend. So when you are struggling, when you have someone who is also struggling, that you can offer each other support can actually help you feel that, I am also useful. I'm also able to help others. So you don't always need to reach out and ask for help from other people. You can also lend a helping hand by volunteering, by going to work with, the less fortunate. That can actually help you feel better about your own situation and mental health. Now, mental health care, we cannot stress more. Going to a therapist, going to a counselor doesn't mean that you're mentally ill. That means you are healthy, you have a sound mind, that you have the best health-seeking behavior to help you overcome your challenges before you have to seek psychiatric help. So mental health professionals and like counselors and psychologists, we are here. Mainly the strategy is talk therapy. I also come up with some rehab methods, like I will help a client sleep better. I will design a sleep chart for them and then talk about the sleep pattern. But a psychiatrist, it's a medical doctor who prescribes psychiatric medication, like for bipolar disorder, for schizophrenia, for panic disorders, that help regulate the neurotransmitters or the nerve cells to help them cope temporarily. However, also because the conditions are so severe that they need psychiatric medication. So if we need help and it's timely that we seek professional help like mental health counselors and psychologists, we will then not have to go to that stage of seeking psychiatric help. In California, we have the psychiatric involuntary commitments called 5150, 5250, and 5350. They are all the same kind of involuntary commitment, but the 3 levels of different durations. Now, that is when a person has such psychiatric crisis or psychosis or mental health condition that we cannot contain and needs to be hospitalized. And that's somewhere that we want to not visit or not go. We want to have a community mental health setting to take care of all of our people in the community, within our community, and try not to let them be institutionalized involuntarily, meaning against their will. So time check now, it's 5 minutes to 7. In a workshop, I would have this activity earlier on. I have asked you if you are not driving or if you're not parked in somewhere that you don't have access to paper and pen. If you can do some of this, write down 2 self-care practices or activities that you would like to have in your life. Reflect on your past experiences and how you cope with your thoughts and feelings. Did they work? Or maybe try 2 coping strategies that you want to do differently. And I think the last part will be the easiest. Write down 3 things you cannot control and 3 things that you can control. So I give you a moment to marinate those thoughts. You don't have to complete it now because there's no way that I can receive your submission, but maybe take a screenshot of this screen. If you can write quickly, you can write this down. I'll give you about a minute more before we go to the next screen, because I would like to collect your thoughts about this presentation and complete a survey again with a QR code that I have come up with. And let us know how you feel after receiving the information that I shared with you this evening, and maybe telling us what you would like to hear more in the next time if I get the opportunity to come speak with you again. All right, I'm going to the next screen. That was the last time when I had this 6 workshop series, so I forgot to take out this slide. So the next one, if I were to come back, we'll be talking about mental health mythbusters if Dr. Miu and Venerable Dihong wants me to come back. So these are the resources, and this is the post survey that I was talking about. I'm sorry I'm making y'all work. Please, if you can, complete the post survey using your phone by answering about 5 to 7 questions. There is also a box. So when you click this and open a link, when this workshop or this presentation ends and your link is still open, you can still continue to work on it. So no hurry, you don't have to complete it before this presentation is over. All right, last but not least, I mentioned that I work with University of the West, and we have a very good newsletter, weekly newsletter that we send out on the things that we do within the university, on the campus, outside the campus. We have lots of meditation sessions, and I talked about the meditative workshop that I just that we are going to run in April. All this wonderful news that we share. If you would like to be part of that newsletter, be on the recipient list for the newsletter, please use this QR code. Yeah, I know we live in the time of QR codes. Sorry, or you can use this link here and ask to be on the recipient list of our newsletter. If you missed this, don't worry. Talk to Dr. Miu, Venerable Dihong, or myself. Send us an email and we can add you to the recipient list. And that's it. I want to give credit to Lily, my collaborator at YWCA San Gabriel Valley. So I do all the talking, I gave her all the materials, and she puts everything up here. So she designed this PowerPoint very wonderfully done. And that is it.
Thank you,
I am
Joanne.
sitting from this screen.
Thank you, Joanne. Can you hear me? Oh, good. Yeah. Before we answer any of the questions, um, just wanted to say that I'm sorry for your loss, and I know you're holding it back. Thunder is her name, and you had her for 13 years?
13 and a half years, she'll be
Yeah,
14.
yeah,
Yeah.
yeah. Yeah, my son recently lost his dog that he rescued. Um, I didn't it it's it's not something I can actually understand until now how important our furry friends are to us. That how especially from a Buddhist standpoint, how we always talk about unconditional love as if this is something that we have to practice. But when it comes to pets, this is what they do is unconditional love. And I know you're struggling, but I hope that becomes part of your teaching material in the future.
Actually, pet grief is one of my areas of specialty.
Mhm, mhm,
The topic last September in Hawaii, and
mhm.
but not until now that I've experienced profound grief. So yeah, you're right. I'm holding it back, but I am a little bit more clinical because of my training, but also I really am privileged to have experienced that love for 13 and a half years.
Yeah. The other comment I want to make is I want to thank you for enlightening me on how griping is actually a therapy. One of the students, there's actually a bunch of comments, questions and comments. I want to go through that. Are you logged into Insight Timer as well? Can you see them?
I think I quit because I thought that was not what we are supposed to be. So would you
Yeah.
like
If you try it again, you might be able to see the comment. Otherwise, I can just repeat it. But one of the comment early, Alberto was saying that when you were talking about dealing with your emotions and your feeling, how you need someone to talk to. I remember when you mentioned how one of your colleagues says, simply, thank you for listening. And I think this is the key that we have to recognize that mental health is really not a sickness. It's just part of human being. And it's just like you said, it's just because I need to wash my hair doesn't mean that I'm sick. It's just part of our self-care, right? And I think that, and so what Alberto said is that when we were talking about that, Alberto said, well, I use my WhatsApp chat for audio recording and I let go of my emotions just like talking to myself.
that's a really good cathartic way. And it's a audio journal too, in a way that you
Exactly. That's what he said. Yeah. Now, in my case, I'm very fortunate that English is not, as is with you and Venerable Hong, is that English is not our first language. So I have to practice all the time. So I'm speaking to myself all the time.
that's funny. I don't know if I shared with you the last time, but I shared with Venerable Dion before. I work and think in English, but when I'm playful, I think in Chinese Mandarin and speak in Mandarin. But when
Yeah,
I'm being critical with myself, remember I was saying I use Cantonese.
yeah. Yeah.
So
Well, I'm older than both of you, so I can tell you that as you get old, your mother tongue comes back, and you realize that
never,
no,
never gone away. It's always been that way. In a way, I feel that the way you attach an emotion to a language processing during that stage, it becomes part of how you think and feel and act about certain things when you use
yeah,
that.
yeah, yeah. So we have 156 people on Insight Timer, 156 students on Insight, and I haven't counted the one on YouTube and Facebook yet. So I want to, on behalf of all the people who participated, first of all, let me just say thank you so much for your time today. And I think it takes time for all of us to digest. But one of the things that I think is obvious to me and probably to most is that the key here is not to feel that you are alone. And I think having someone to listen without judging you is very important. Now, I actually learned that as a life experience. Turns out my daughter had a boyfriend back in the days when she was in college, and he turned out to, and I have permission from her to speak about this. And turns out that he was very abusive when they were together. And then when they were separate, he continued to stalk her. But I'm very shameful to say that I never actually listened to her. You know, every time she mentioned it, I would try to find ways of fixing the problem. And that is the problem that many of us have, is that we're not good listeners, myself included. And because we, you know, maybe that is just being a father or just being an immigrant. You know, we always try to jump to finding a solution, and that turned out not to be the thing that other people want.
Oh, don't be so hard on yourself or our culture background, but I have come across many different cultural backgrounds have the same kind of attitude towards a generational gap. Like, I'm the senior, you're the junior, I know better than you do, you know, despite our cultural backgrounds. What actually taught me when I was an intern that we cannot see children just as people of less being. Even if they were 5, 6, 7 years old, they may not understand or process things or verbalize things, but they are just as valuable as us. We are in the same level playing field. We just have to use different methods to communicate. A lot of people say 5, 6 years old, what kind of, you know, mental troubles do they have? Oh, if you were to recall your childhood when you were 5 or 6 or 7, we had our troubles, maybe not as big as how you see it now as an adult, but to us, it was devastating then. So if we can value each and every living thing as valuable as our own life, but using different approaches, I think that's the best way to express compassion.
So Roberto asked a follow-up question, and you're not seeing it, right? So let me just.
No, I'm not signing that. So
Okay, so he said that how after so many years of therapy in investing in my mental health, still it is very difficult to respond instead of react, like it's specifically with frustrations of anger.
I kind of want to kind of shape my response to this. My first curious question is it the same therapist? Because in my profession, we always feel that when it's time for us to move on, we should. Because sometimes this therapist has done his or her work with you. And if you can't see any progress, it's probably trying a time to try another new method. In Chinese, when we say 我们的缘分已经尽了, so maybe that's where you should go up to this point and find some other way. And that by no means is saying that your therapist is not good for you, but the work is done here. It's probably time to seek another therapist. But if you have been with different therapists and yet you haven't seen the work, the common denominator is you and not your therapist. So we have to first acknowledge what we are struggling with, what are the factors that we can or cannot control, and then we work further from there. And I'm sure in therapy, those are the things that we've talked about. But the one thing that I wanted to mention, but I didn't do it during my presentation, is that we go through years and years of training to refrain from giving advice in therapy. We don't give advice in therapy. We talk about things together and we find out what you want to do about that issue or that situation or that problem. And then if it's healthy, if it's something that's worth a try, we are your cheerleader. We are there to give you unbiased, non-judgmental support. If we haven't experienced that in therapy, I would strongly recommend you to relook at what has happened in that therapy room between you and your therapist.
Okay, thank you. The last post was really not a question, but a comment, and it's from Serena. I think the first part was addressed to me, which is, thank you for getting permission before sharing her story. Yeah.
comments.
No. Okay. And then she said, thank you for being vulnerable about your experience with your daughters. Okay, I got that. Our instinct is to comfort, and sometimes that's a dismissive response. Yeah, I learned that from experience. Mindfulness helps us learn to stay in the present and then also observe and listen to the authentic truth with loving kindness and compassion. Yeah. Yeah. Thank you for that. Thank you for that. Yeah. Okay. So hopefully, you mentioned you might be, I'm going to, you always, I used to be a salesman, so you always get the order before you leave. You mentioned you might be able to commit yourself to 4 times a year, maybe every quarterly.
Not sure if, yeah, I'm not sure if it's for sure, for sure. With such bad English, I'm not sure if it's for sure, for sure. But yeah, it's something that we can look at and work on. But I love traveling. So summer, I'm always not in the country, and I travel at least 2 to 3 times a year. So
Yeah.
if I can, maybe yeah, quarterly is something that we can look at. But I would
Okay.
like to present something that is of value and of knowledge gain to your followers. So if this is too basic, then we shouldn't come back with the same kind of level of knowledge. So maybe the collection of the survey would help us understand what is needed, what is recommended.
Okay. One of the students says, says, let me see. Oh, another comment was empathy to you. We just lost a 15-year-old lab, in our heart. So we acknowledge that.
Thank you.
Okay, so Kim says lots of helpful information, many good reminders. Thank you so much, and I love to hear your presentation about mental health mythbuster. Okay, all right, all right. Okay. Yeah, Serena also have the same comments towards dealing with overwhelmed negative media. Well, positive media don't sell, so that's why they're negative. A comment from Marita, a very good help for me is Peter Kramer's book, Never Depression, which he wrote as an answer to all Rocketeer on his first book, Listen to Bonzek. Oh, okay. I'm not sure I followed that one. But anyway, these are very good comments. So with that, perhaps let me turn off the outside first and say hi to my other students, my Cantonese students. So let me stop that. Reactions. Okay. All right. So thank you all on Insight Timer on Facebook and YouTube. Let me turn that off first.